have before us today Governor Tim Pawlenty of Minnesota and Governor Edward Rendell of Pennsylvania. These leaders have been at the forefront of the healthcare debate that has implications for the entire nation. While I understand their approaches to reform may be very different, we hope to gain insight on how their proposals can improve health coverage for the citizens of their states. This is the fifth hearing that the Small Business Committee has held on the issue of access to health insurance for small businesses. It is a problem that threatens to undermine our entire healthcare system. It is for that reason we are continuing to work with the small business community and stakeholders to identify ways that Congress can address this crisis. While major change may be a year away, the committee is attempting to identify consensus reforms that can either be enacted this year or as part of any healthcare reforms made in the future. The governors here today are fully aware of the obstacles that meaningful healthcare reform presents. With any efforts to increase coverage that impacts our nation's health system, it will inevitably create some form of opposition. Governor Pawlenty and Governor Rendell are responding to the harsh reality of rising healthcare costs and declining coverage in their states. This committee is particularly interested in the steps that Minnesota and Pennsylvania are considering to ensure small firms have access to affordable health insurance coverage. More than a year ago, Governor Pawlenty laid out his Healthy Connections platform that has set the stage for reforming his state. Governor Rendell is also in the midst of a major debate on comprehensive changes to the healthcare system in Pennsylvania. He is now working with the legislature to advance his prescription for Pennsylvania plan. Both of these plans make small businesses a critical component of expanding coverage. I believe it is becoming increasingly clear that addressing the problem of the uninsured requires a focus on encouraging small businesses to offer health insurance coverage. Today's discussion will hopefully allow the committee to gain new perspective on approaches to improving healthcare choices for small businesses. In the past year, this committee has examined how competition among insurers and risk are cost drivers for small businesses seeking health insurance. These are problems that I believe can and must be addressed by changes at both the state and federal level. While demographics and localized issues may shape the solutions that you are proposing, it is clear that you both agree that the current system needs to change. The matter of affordable coverage for small businesses is something that every state is facing across this nation. Given the challenges, it comes as no surprise that 6 out of 10 uninsured Americans, including more than 10 million children, are in households headed by self-employed workers or small business employers. I look forward to today's testimony, and again, thank you for being here to discuss this important issue. I will now yield to the ranking member, Mr. Chabot, for his opening statement.
Thank you, Madam Chairwoman, and good morning. Thank you for holding this hearing on state initiatives to expand health insurance. And special thanks to our distinguished witnesses who are taking time from their National Governors Association winter meeting here in Washington to be with us today. Governors Pawlenty and Rendell, we really do appreciate your participation here this morning, and we'll stop talking shortly so we can get to you. 47 million Americans are uninsured, and for those who are uninsured, and for those who are insured, costs continue to skyrocket. For small businesses, health care is continually ranked as one of the top concerns. And as we have heard expressed by witnesses throughout this committee's 10 health hearings so far, this Congress, it continues to be a problem in this country. With premiums escalating, small companies face limited choices of health insurance providers. Many operate within margins so thin that they cannot provide health insurance for themselves or their employees. According to the Government Accountability Office, health care spending is a chief culprit of our national debt. The structural debt at the current rate of growth and spending in federal entitlements is $53 trillion with a T, assuming future promised and funded benefits of Medicare, Social Security, Veterans Health Care, and other programs are kept. These figures are nothing short of astonishing, not to mention disturbing. The cost of health care has outstripped inflation by 2 percentage points per year each year for the past 40 years, and costs are expected to continue to rise. Health care costs for individuals and small businesses must be addressed at present, and they must be curtailed for our children and grandchildren. These are tough problems with many facets and no easy answers. Clearly, entitlement spending must be addressed, and I believe there are important steps Congress can take to bring down the cost of health care and make it more accessible. For example, I introduced the Health Insurance Affordability Act, which would allow every American to deduct 100% of the cost of their health insurance premiums when calculating their federal income tax. It's also important to eliminate frivolous lawsuits, which drive up health care costs. To that end, many of us support the Health Act, which would cap non-economic damages and ensure that only those with legitimate claims can proceed through a lawsuit. And many of us also support legislation that would allow small businesses to join together with national associations to purchase health insurance for their employees. The increased purchasing power and lower premium cost would encourage small companies to offer health insurance to their employees if they don't already. The House has passed this legislation many times in previous Congresses, only to be stalled in the Senate. Because Congress has not addressed these issues, many states have become incubators of health care reform proposals. Some have proposed innovative programs to expand health insurance coverage. The governors who are with us today have been at the forefront in offering imaginative health insurance solutions in their states. We are eager to hear your ideas for reform. Madam Chairwoman, thank you again for holding this important hearing, and I think we all look forward to both governors' testimony here this morning. And thank you for being here, governors.